Now we'll perform otoscopy. Same with the other ear.
Hello, my name is Huzefa. Today I am going to perform the renal test. In this, we will check for the bone conduction and the air conduction. Okay, so I will. And for the bone conduction, I will put on the mastoid bone. In this test, the air conduction is better than the bone conduction.
Hello everyone, my name is Bhattacharya Vipasha. Today I will be performing the physical examination of the ear, particularly the Weber's test. For this test, we will be using the following instruments. Basically, we need a tuning fork of 512 Hz, a sanitizer of course, and gloves. So let's begin with the procedure. Now, we will be beginning with the Weber's test. First of all, I will be putting on my hand gloves. Now I'll be using the hand sanitizer to keep the process sterile. Now, by using a tuning fork, first I'll be striking it on any of my joints and then putting on top of the patient's head. And ask the patient where she could hear the sound more, like is it on one side or both sides equal. That will be asking that to the patient. So let's begin. Where can you hear the sound?
Both the sides.
Okay. So this completes the Weber test. Now I will be discussing the results of the Weber test. As this was a normal test, there was no lateralization of sound. But if there is a unilateral conductive hearing loss, then the lateralization of sound would be basically towards the affected ear. Whereas if there is a sensory neural hearing loss or unilateral sensory neural hearing loss, then the sound or the lateralization of the sound would be on the good ear, the better ear, which is not affected. So those would be the findings of the Weber test. Thank you.
Anterior nasal examination, we will start with the inspection. First we will inspect the nose anteriorly, inferiorly and from the sideways to check for any deformities or for any lesions or visible masses. And next, with the help of the light source, we will check the nostrils for any visible masses or any foreign bodies. Next, with the help of the otoscope, we will check the nasal canal to check for any septal deviations or any visible polyps or any foreign bodies.
Now I am going to inspect the patient's oral cavity. Ma'am, can you please open your mouth? See, Can you please open your mouth? Now I am going to palpate your oral cavity with my gloved hand. Now I am doing bilingual palpation for parotid gland and for submandibular gland for both sides.
We begin the neck examination by first noting the symmetry or any lesions or scars over the neck. Next, we will do lymph node examination. For lymph node examination, we must stand behind the patient and now gently we'll flex the head of the patient so that the muscles are relaxed. Using the tip of the fingers, we'll start palpating the lymph nodes, submental, submandibular, cervicals, supraclavicular, posterior cervicals, preauricular, posterior auricular, and occipital. Now we will inspect the trachea for its deviation by placing the index finger between the trachea and the sternocleidomastoid, and we'll check for any deviation. Now we will throw the tangential light from the tip of the chin and we'll look for the contours of the thyroid gland which are located below the cricoid cartilage. Now I'll ask the patient to sip some water and swallow, and then we will observe the thyroid gland. Now I'll ask the patient to again sip some water and swallow. And then we will feel for the isthmus rising up.